The purpose of this study is to evaluate the patient's ambient heart rhythm during a full daily cycle. The physician or other qualified healthcare professional instructs the patient in the use of an external electrocardiographic (ECG) recorder, also known as a Holter monitor. Long-term external electrocardiographic (ECG) recording is a diagnostic procedure that provides continuous rhythm recording of the patient's heart while the patient is engaged in the activities of daily living. Rhythm disturbances and waveform abnormalities are detected. Information is provided regarding the frequency of these disturbances. The physician or other qualified healthcare provider instructs the patient in the use of the external ECG recorder. A technician places ECG leads on the patient's chest, and the patient wears the recorder for up to 48 hours or 48 hours up to 7 days or more than 7 days up to 15 days. During this time there is continuous rhythm recording and storage. The patient returns the device and the recorded heart rhythm is converted into digital format by a technician. The technician uses a scanning methodology to classify different ECG waveforms and to generate a report. The generated report describes the overall rhythm and significant arrhythmias. External electrocardiographic recording up to 48 hours by continuous rhythm recording and storage, includes recording, scanning analysis with report, review, and interpretation by a physician or other qualified healthcare professional. Recording, scanning analysis with report, review and interpretation by a physician or other qualified healthcare professional. External electrocardiographic recording for more than 48 hours up to 7 days by continuous rhythm recording and storage, includes recording, scanning analysis with report, review, and interpretation. Recording, includes connection and initial recording. Scanning analysis with report, review and interpretation. External electrocardiographic recording for more than 7 days up to 15 days by continuous rhythm recording and storage, includes recording, scanning analysis with report, review, and interpretation. Recording, includes connection and initial recording. Scanning analysis with report, review and interpretation. External mobile cardiovascular telemetry with electrocardiographic recording, concurrent computerized real-time data analysis and greater than 24 hours of accessible ECG data storage, retrievable with query, with ECG triggered and patient-selected events transmitted to a remote-attended surveillance center for up to 30 days, review and interpretation with report by a physician or other qualified healthcare professional. Technical support for connection and patient instructions for use, attended surveillance, analysis, and transmission of daily and emergent data reports as prescribed by a physician or other qualified healthcare professional. Mobile cardiovascular telemetry, MCT, uses external electrodes placed on the patient's body to continuously record electrocardiographic rhythm. Data segments are transmitted to a remote surveillance location by phone signal, cellular or landline. This is accomplished automatically and does not require patient intervention. Selected rhythm segments may be triggered for transmission automatically by rapid and slow heart rates or by the patient during a symptomatic episode. Data are analyzed continuously in real time. A remote technician responds to the alerts from the external device, reviewing the data and notifying the physician or other qualified healthcare professional depending on the stipulated criteria. Remote monitoring of a wireless pulmonary artery pressure sensor for up to 30 days, including at least weekly downloads of pulmonary artery pressure recordings, interpretation, trend analysis and report, by a physician or other qualified healthcare professional. A pulmonary pressure monitoring system permits ongoing monitoring and measurement of a patient's heart rate as well as systolic, diastolic, and mean pressures in a patient diagnosed with non-rhythm-related cardiac conditions, i.e., heart failure. Pulmonary arterial pressure, PAP, readings transmitted from an internally implanted sensor to a wireless electronic unit are subsequently transmitted to an internet-based file server or monitored by a surveillance technician with results sent to an online portal that can be accessed by the patient's treating healthcare provider. Through accurate monitoring of patients diagnosed with heart failure, HF, for exacerbations, it is possible to minimize the need for additional hospitalizations and the associated complications and allow for early pharmacological intervention. External patient and, when performed, auto-activated electrocardiographic rhythm-derived event recording with symptom-related memory loop with remote download capability up to 30 days, 24-hour attended monitoring, includes transmission, review, and interpretation by a physician or other qualified healthcare professional. Recording, transmission and analysis, review and interpretation by a physician or other qualified healthcare professional. The purpose of this study is to evaluate the patient's ambient heart rhythm during symptoms. The physician or other qualified healthcare professional instructs the patient in the use of an external rhythm monitor. A technician places ECG leads on the patient's chest, and the monitor uses a symptom-related memory loop mechanism with remote download capability up to 30 days to record the patient's rhythm. During symptoms, the patient activates the monitor by pressing a button. The resulting recording includes ECG activity prior to and during symptoms. The patient uses the device to transmit the recording over the telephone line, allowing a rhythm printout to be generated. The provider reviews and interprets this rhythm strip. Signal-averaged electrocardiography, SEEC, with or without ECG. Electrodes placed on a patient's chest record the heart's electrical activity. This technique uses signal-averaged electrocardiography, SEEC, and may include a standard electrocardiogram. Programming device evaluation, in person, with iterative adjustment of the implantable device to test the function of the device and select optimal permanent programmed values with analysis, review, and report by a physician or other qualified healthcare professional. Single lead pacemaker system or leadless pacemaker system in one cardiac chamber. Dual lead pacemaker system. Multiple lead pacemaker system. Single lead transvenous implantable defibrillator system. Dual lead transvenous implantable defibrillator system. Multiple lead transvenous implantable defibrillator system. Implantable subcutaneous lead defibrillator system. Subcutaneous cardiac rhythm monitor system. Subcutaneous cardiac rhythm monitor system. A programming device evaluation is performed in person in order to test the device's function and select the most favorable permanent programmed values. Patients with previously placed subcutaneous implantable defibrillator systems or previously implanted pacemakers or transvenous implantable defibrillator systems or previously placed subcutaneous cardiac rhythm monitor systems require periodic programming device evaluations. This diagnostic procedure includes a face-to-face assessment of all device functions, including analysis, review, and report by a physician or other qualified healthcare professional. Components that must be evaluated in order to assign a code from this range include the battery, leads, programmed parameters, presence or absence of therapy for ventricular tachyarrhythmias, and heart rhythm. Stored and measured data regarding these components are retrieved using an office, hospital, or emergency room instrument. This information is assessed to discern battery voltage, lead impedance, and settings for rhythm treatment and tachycardia detection, as well as to determine the defibrillator's current programming. If necessary, the sensing value and rate response, upper and lower heart rates, AV intervals, pacing voltage, and pulse duration, and diagnostics are adjusted. Ventricular tachycardia detection and therapies may also be altered. These codes include physician or other qualified healthcare professional review, interpretation, and report, and are assigned per procedure. Report 93279 for evaluation of a single lead pacemaker or leadless system, one in which there is pacing and sensing function in only one chamber of the heart. Report 93280 for evaluation of a dual lead device, one with pacing and sensing function in only two chambers. Report 93281 for evaluation of a multiple lead device, one with pacing and sensing function in three or more chambers. Peri-procedural device evaluation, in person, and programming of device system parameters before or after a surgery, procedure, or test with analysis, review and report by a physician or other qualified healthcare professional, single, dual, or multiple lead pacemaker system, or leadless pacemaker system. Single, dual, or multiple lead implantable defibrillator system. A programming device evaluation is performed in person in order to test the device's function and select the most favorable permanent programmed values. Patients with a previously implanted pacemaker or defibrillator systems may require adjustment of the device to patient-specific settings prior to a surgery, test, or procedure. The device system data is interrogated to evaluate the battery, leads, and sensors, as well as the stored patient and system measurements. If necessary, the device is programmed to settings appropriate for the surgery, test, or procedure. A post-procedure evaluation and programming may also be performed, with adjustments as required. Report 93286 for evaluation of a single, dual, or multiple lead implantable pacemaker system or leadless pacemaker system. Report 93287 for evaluation of a single, dual, or multiple lead implantable defibrillator system. Both codes include physician or other qualified healthcare professional analysis, review, and report. Interrogation device evaluation, in person, with analysis, review, and report by a physician or other qualified healthcare professional, includes connection, recording and disconnection per patient encounter, single, dual, or multiple lead pacemaker system, or leadless pacemaker system. Single, dual, or multiple lead transvenous implantable defibrillator system, including analysis of heart rhythm derived data elements. Implantable subcutaneous lead defibrillator system. Implantable cardiovascular physiologic monitor system, including analysis of one or more recorded physiologic cardiovascular data elements from all internal and external sensors. Subcutaneous cardiac rhythm monitor system, including heart rhythm derived data analysis. Wearable defibrillator system. Patients with a previously implanted device, such as a cardiac pacemaker, implantable cardioverter defibrillator, ICD, implantable cardiovascular monitor, ICM, or implantable loop recorder, ILR, require periodic interrogation device evaluations. This diagnostic procedure includes a face-to-face assessment of all device functions. Components that must be evaluated in order to assign 93288 include the battery, lead, capture and sensing function, heart rhythm, and programmed parameters of a single, dual, or multiple lead pacemaker system. Code 93289 requires evaluation of the battery, lead, capture and sensing function, heart rhythm derived elements, presence or absence of therapy for ventricular tachyarrhythmias, and programmed parameters of a single, dual, or multiple lead ICD system. Code 93290 requires analysis of at least one recorded physiologic cardiovascular data element obtained from internal or external sensors and evaluation of programmed parameters of an ICM. Code 93289 requires evaluation of the battery, lead, capture and sensing function, heart rhythm derived elements, presence or absence of therapy for ventricular tachyarrhythmias, and programmed parameters of a single, dual, or multiple lead ICD system. Code 93290 requires analysis of at least one recorded physiologic cardiovascular data element obtained from internal or external sensors and evaluation of programmed parameters of an ICM. Code 93291 requires evaluation of heart rate and rhythm during recorded episodes, from both patient-initiated and device algorithm-detected events, as well as evaluation of programmed parameters of an ILR. Code 93292 reports an interrogation device evaluation of a wearable defibrillation system. These codes include physician or other qualified healthcare professional analysis, review, and report. They also include connection, recording, and disconnection, and are assigned per procedure. Transtelephonic rhythm strip pacemaker evaluation, single, dual, or multiple lead pacemaker system, includes recording with and without magnet application with analysis, review, and report, by a physician or other qualified healthcare professional, up to 90 days. Patients with previously implanted pacemakers require periodic analysis of pacemaker function. A pacemaker may be implanted to control a patient's irregular heartbeat. This code applies to transtelephonic pacemaker monitoring, a form of evaluation in which the patient sends a rhythm strip over the telephone using a transmitter. This transmission is recorded by a receiving location using a receiver/recorder. The rhythm strip is recorded with and without a magnet being applied over the pacemaker and is assessed for heart rate and rhythm, as well as atrial and ventricular capture and sensing, if observed. The pacemaker's battery status is also determined. Code 93293 may be reported for a single, dual, or multiple lead pacemaker system, and includes physician or other qualified healthcare professional analysis, review, and report. This code should be reported only once per 90-day period.